Discharge against medical advice. If you had seen my video on patient rights and responsibilities, I would have told you that the patient has the rights to say no to a treatment. If a patient has the sound mind, they can refuse the treatment at any cost. So as a clinician or as a healthcare professional, what we can do is that we can explain the risk factors involved for the patient's medical condition. So in spite of explaining the medical condition, the risk factors involved, if a patient feels that they want to refuse the treatment, they have the right to refuse the treatment. So they can leave the hospital premises before getting the treatment. So these patients are called as the AMA patients or DAMA patients, discharge against medical advice. So as a hospital, what else we can do is that we have to document the reasons for which a patient is leaving or refusing a treatment. A patient can refuse a treatment for so many reasons. They can refuse a treatment for their own wellness, or they can refuse a treatment when they don't feel okay with the hospital, or they can refuse a treatment when they don't have the money to pay for the bills. There can be n number of reasons for which a patient can refuse a treatment. So what we can do is that if the reasons are matching with the hospital, and if at all as a healthcare professional you can address those reasons, and if you can rectify those reasons, you can always rectify those or the reasons listed by the patients for refusing a treatment. And after rectifying or acting practically at that moment, still if the patient refuses the treatment, the patient has the right to refuse the treatment. So it is necessary to document why a patient leaves before getting the treatment, because this can be useful for the hospitals to address the future patients in a better way. So it can be like an evidence for the hospital that the patient has left for so and so reasons. It can be of personal reasons as well, and this is not something concerning to the hospital. This is not something the hospital has to do personally with the patients. So this is like an evidence for the hospital safeguarding themselves and safeguarding the patients as well. So when a patient enlists the problem, so you can rectify it very well. This is again an aspect of disclosing an NC in a better way. Thank you.